Good morning to all those who make this broadcast possible, to Abdiel, to our sign language interpreter, and good morning to everyone tuned in to this briefing. We start today's press conference with the unfortunate news of the death of 2 people with COVID-19 yesterday. The first was a 53-year-old woman from Ciego de Ávila, suffering from some pre-existing health conditions. The patient was a confirmed case contact and was admitted to hospital on September 20th. She was then transferred to intensive care on September the 22nd. After being admitted to hospital, the patient began to experience a series of complications. Treatment protocols were applied. However, yesterday, the patient suddenly experienced shortness of breath, after which she went into cardiorespiratory arrest. Despite efforts to revive her, the patient sadly died. We offer our condolences to her family and friends. The other patient was a 75-year-old man from Habana del Este in the province of Havana, who also suffered from comorbidities. The patient was admitted to hospital on August the 14th and transferred to intensive care 2 days later on August the 16th. The patient suffered a series of complications from the outset, remaining in hospital for 39 days. The patient was reported as critical and suffering from a range of metabolic, respiratory, and neurological complications. Yesterday, he went into cardiorespiratory arrest, from which it was not possible to revive him. We offer our condolences to his family and friends. Today, 8,291 people are hospitalized in Cuba. 6,322 are under observation. There are 1,411 suspected cases and 558 confirmed active cases. Yesterday, we processed over 7,000 samples, 7,744, in our various molecular biology laboratories. 2,452 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 900 in Havana's Hygiene, Epidemiology and Microbiology Center, 818 in Villa Clares, 417 in Santiago de Cubas, 564 in the Genetic Engineering and Biotechnology Center Lab, 425 in the Hermanos Almahedas Hospital, 411 in the Molecular Immunology Center, 333 in the Civil Defense Laboratories, 300 in the Fructuoso Rodriguez Hospital, 299 in the ICA Laboratories, 215 in the National Center for Genetics, and 179 in the Manuel Fajardo Hospital. Of the 7,744 samples processed, 62 tested positive for COVID-19. That's 62 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 584,894, of which 5,412, or 0.93% of people, have tested positive for the virus. Of the 62 positive cases diagnosed yesterday, 58 are Cubans and 4 are foreign residents in the country. These foreign residents contracted the virus in Cuba and are therefore not imported cases. 53 or 85.5% of the 62 positive cases yesterday are confirmed case contacts. Of the 62 cases diagnosed yesterday, The source of infection linked to 9 is yet to be determined. The source of infection in 65 cases reported over the last 15 days is therefore still being investigated. Yesterday, no one to have tested positive for the virus contracted it abroad, meaning that imported cases remain at 441. Of the 62 diagnosed cases yesterday, 31 are male, for 50.5% of all cases, and 31 are female, representing 49.5% of all diagnosed cases on the island. 46, or 74.1% of the 62 cases yesterday, were asymptomatic at the time of testing. Overall, 60.3% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing. By age group, 9 positive cases diagnosed yesterday are under the age of 20, 8 of which are under 18 years of age, for a total of 591 children or pediatric cases to have tested positive for the virus in Cuba. Of these, 506, or 85.6%, have recovered from the virus and been discharged from hospital. Meanwhile, 21 people to have tested positive for COVID-19 yesterday are between 20 and 39 years of age. 21 cases are between 40 and 59, and 11 are over the age of 60. Of these 62 autochthonous cases diagnosed yesterday, 27 belong to Havana, 22 to Ciego de Ávila, 6 to Sancti Spiritus, 6 to Mayabeque, and 1 to Matanzas. The 6 cases from Mayabeque belong to the municipalities of Guines with 4 and San José de las Lajas with 2 cases. The 27 cases from Havana belong to the municipalities of Regla with 6, 10 de Octubre with 3, Habana Vieja 3, Marianao 3, Plaza de la Revolución 3, Arroyo Naranjo 3, Centro Habana 2, Habana del Este 2, San Miguel 1, and 1 case to Boyeros. The 1 case diagnosed in Matanzas belongs to the municipality of Cárdenas. The 6 cases from Sancti Spiritus belong to the municipalities of Sancti Spiritus with 3 and Taguasco, also with 3 cases. From Ciego de Ávila belong to the municipalities of Ciego de Ávila with 14, Venezuela with 5, Cerro Redondo 1, Florencia 1, and Majagua, also with 1 case. Given yesterday's results by province, Ciego de Ávila continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 56.97. Havana follows with a rate of 18.83, then Matanzas with 10.28, Sancti Spiritus 6.87, Artemisa 4.47, Mayabeque 3.64, Camagüey 1.18, and Holguín with 0.39. Meanwhile, Cienfuegos, Pinar del Río, Las Tunas, Villa Clara, Granma, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality have reported no new cases over the last 15 days, some of which have reported no new cases for several weeks, and others none over the last few months. Cuba's rate therefore stands at 7.20 per 100,000 inhabitants over the last 15 days. To summarize, of the 5,412 people who have been diagnosed with the virus thus far in Cuba, 558, or 10.3%, are active hospitalized cases. Of these, 550, or 98.5%, are clinically stable. Yesterday, 2 people died as a result of the virus, meaning that the COVID-19 death toll on the island rises to 120, with a mortality rate of 2.21%, lower than the global rate of 3.04% and the regional rate of 3.37%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 74 people were discharged from hospital, a positive result when compared with the number of confirmed cases diagnosed yesterday. 4 people were discharged from hospital in Artemisa, 44 in Havana, 3 in Mayabeque, 1 in Matanzas, 1 in Sancti Spiritus, 1 in Las Tunas, and 20 in Ciego de Ávila. This means that to date, 4,732 people, or 87.4% of all confirmed cases in Cuba, have recovered from the virus. Today, 3 patients being treated in hospitals in Camagüey and Ciego de Ávila continue to be in a critical state. 5 patients in hospitals in Havana and Camagüey are also reported as serious. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 319,603 people were diagnosed with the virus, for a total of 32,289,082 confirmed cases since the start of the pandemic. Yesterday, 5,756 people died of the virus worldwide, for a total of 984,040 COVID-19 fatalities and a mortality rate of 3.04%. The region of the Americas, which accounts for 50.02% of all cases worldwide, reported 121,016 new cases yesterday, for a total of 16,153,731 people to have been diagnosed with the virus. Meanwhile, 3,167 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 544,801 and a mortality rate of 3.37%. The United States continues to top the list of countries worst affected by the pandemic, with almost 7 million confirmed cases. Then India with over 5,818,000. Brazil comes next with more than 4,657,000 confirmed cases. And then Russia with over 1,128,000 confirmed cases. From the Americas, after the United States and Brazil, comes Colombia, Peru, Mexico, Argentina, Chile, Canada, Bolivia, Ecuador, the Dominican Republic, Panama, Guatemala, and Honduras. These are the countries with the highest number of cases in the region. Cuba occupies 21st place on this list. Regarding mortality rates, Mexico has the highest, with 10.54%, followed by Ecuador with 8.55%, and Bolivia with 5.86%. This is the information we have on the behavior of the pandemic in Cuba and the world.